Hello again, everybody. This is Craig Evans of Autism Hangout, and thank you for tuning into this episode of the Ask Dr. Tony Show, where Dr. Tony Atwood answers your questions about autism. Hello, Dr. T. Gosh, I haven't seen you for a while. How have you been lately?
Yeah, Craig, I've been fine. It's the middle of the summer here in Australia, hence what I'm wearing is very much summery clothes. But I've just got back from Europe, presentations in Geneva, Oxford, and London, and had a great time. And it was lovely to be traveling again after COVID.
I know you give talks about certain topics, but I also know that you have lots of content that you and Dr. Michelle Garnett have put together that you're now taking out to the public. Can you talk a little bit about that?
We've decided to take our wisdom and distill it into presentations that are webcast. So you can watch it live, but you can also then download some of the presentations. For example, the ones in London were basically diagnosis and support for autistic girls and women and emotion management. Each one was a whole day. So if you go to atwoodandgarnettevents.com, you can download some of the latest information. It's like an Ask Dr. Tony for the day.
Excellent, excellent. Okay, as usual, we have way more questions than we have time, so let's just go ahead and jump into it. The first category is diagnosis, ASD, and narcissistic personality disorder. I'm curious about the comorbidity of Asperger's and narcissistic personality disorder. Like, how can the often naive ASPI also manifest the manipulative behavior of the pathological narcissist? I know they can coexist, but the two together just seem like a bit of an oxymoron. Thank you.
Okay, I agree. This is narcissism not in the DSM-5 diagnostic criteria. This is the interpretation of other people that the autistic person appears very arrogant, very self-centered. And really what they're doing is forming a compensation for autism. So if you're not very good socially, not very good at sport, especially at high school, one of the things that you value very much is your intelligence. And the trouble is that can lead to a sense of grandiosity, which can be associated with narcissism, that my intellect is more important than anything else, and be very judgmental and critical of those who aren't as smart as the autistic person themselves. But it also means that their sense of self is by their achievements, often intellectual qualifications and so on, rather than their social network. So there can be confusion that the approach of I'm superior to others is the opposite of depression and low self-esteem. So the pendulum has swung away from I'm defective to I'm superior. But it's a compensatory mechanism. And sometimes being unaware due to the autism of how that is affecting other people. And other people are rather annoyed by it. And so it's a compensation mechanism, but not a formal diagnosis.
Very good. Still in diagnosis, this is about Myers-Briggs and ASD. And as you know, we get a fair number of questions from folks with Asperger's about the accuracy or the relevance of the Myers-Briggs personality inventory. So this is one of those questions. Has any research been done into the relationship between ASD and the Myers-Briggs personality types? I have ASD, and I have a Myers-Briggs preference for introversion, thinking, feeling, and judging, or INFJ. Any thoughts?
Now, first of all, I'm not an expert on the Myers-Briggs. You'd have to talk to those people concerned. But I know a number of autistic individuals who've completed the Myers-Briggs, either for their own personal interest or due to employment and so on. But I don't know of any recent research that's seen a particular profile. Now, a person who's autistic is different, so you may well get a particular profile of occurring. Now, the person here is yes to introversion. It's being alone, not lonely. In other words, I can socialize, but it's not my first choice. It's not a source of enjoyment. I have solitary pursuits that I really enjoy. So that would be appropriate. Thinking, yes, some of the deepest thinkers and philosophers are autistic. You do tend to think a lot, so that's a possibility. Also, sensing and feeling, there can be issues of extraception and being very sensitive to the sensory environment, but also a sixth sense sensitivity to the emotional state of other people, and also judging. And that can be an autistic characteristic. So, yes, I think your INFJ may well be very appropriate. Now, the thing is, there will be other people tuned into this, may have completed the Myers-Briggs and have their own thoughts. This could be a fascinating discussion.
Mm-hmm. Very good. Also in the diagnosis category, telling the family that they have it too. This question is very common. I am a retired social worker and I got my training trying to help my autistic daughter. After watching your videos, I had the aha realization that we have many members, a cluster of people, all ages in our family, that are most likely on the spectrum. So my question is, should I not educate my family? Or if I decide to educate them, how should I go about it so as not to get blowback? They all have a negative view of autism, especially my daughter, who is 50 and is on disability.
Yeah, autism can occur within and between generations. And this is whether this person is prepared in the mythology to open Pandora's box and do a paradigm shift for everyone. Now, the thing is, they may have autistic characteristics, but throughout their life, they have created a scaffolding, a sense of self, etc., that has been successful, probably from their perspective. But you're going to challenge that, and you're going to take all the scaffolding away and replacing it with autism, which may not be easy for the person to do. So I would be very cautious of a family gathering and suddenly announcing your revelation that this is in everybody, because they're going to gang up on you, reject you, and reject any suggestion of autism in the future. Now, what you may do is one by one. Now, there may be a family member that's having problems with depression or friendships and relationships or career, where knowledge of autism and access to expertise and resources would be worth it. So you may then approach that one person and say you've noticed some of the autistic characteristics that may help in some of the issues that you have. So in other words, the reason has got to be of benefit for each of those individuals, and really do this one at a time. Now, there are going to be issues of family dynamics and conflict and so on that may be useful for the person who wrote this question, that they can see the family through an autism lens, which will help them help others. In other words, you speak autistic or Aspergerese to them as a successful way, but they don't know that. Mm-hmm. So I must admit, I would be very cautious of an announcement to the whole family in one go, because it's likely to be destructive. It needs to be constructive, one-on-one.
Yes. And as we know, we get lots of questions too about relationships between parents and children. So knowledge is power. Be brave, but be mindful.
Yeah. Can I really extend that a bit further? Because I was concerned that her 50-year-old daughter has a negative view of autism. And unfortunately, the diagnostic criteria are devastating in really, oh dear, I'm defective. There's something seriously wrong with me. Yeah. And that can lead to a belief about autism as being defective. Mm-hmm. I would suggest with your daughter to go through her qualities. And as this person, the mum, is knowing about autism, which of her positive characteristics, personality or abilities, may be due to autism. Otherwise, she's seeing autism as an explanation of all her deficits. So I'd also work with your daughter's description, and it may well be that there can be a change in her perception of autism. It's really creating and noticing what she does well. When you did that, that's probably because you're autistic, and that's why you're so good at that. Mm-hmm.
New category, living with autism. And this is something we also hear about, and it's unfortunate. Estrangement and ASD. Hello, I'm trying to find some sort of support or suggestions for how to reach out to our 35-year-old son who has Asperger's. He has stopped communicating with his entire family for 7 years. We've written letters, we've tried calling him, and we've knocked on his door, but he simply does not respond. We are worried out of our minds. He has above average intelligence and is an electrician in a large city, 3 hours away from us. He was usually very kind when he was small, so he was never a huge behavioral issue growing up. He definitely does not express much emotion. Do you have any suggestions on how we could possibly reach him effectively without flipping him out? It's like he has no attachment whatsoever, and it's heart-wrenching. He's our only child.
Okay, first of all, there's a reason from your son's perspective, but he may not be able to disclose and articulate why that is. And that's what you need to know, because otherwise this could continue for a long period of time. There are several factors that may be relevant. A characteristic of autism is what we call black and white thinking. And this may mean that as far as your son is concerned, the estrangement is for contravening a particular rule that he has. There's no compassion, no understanding other people's perspective. Right, that's it. You broke the rule. That's it. You are out of my life forever. And that black and white thinking is devastating for other people because they don't understand it. Maybe an accidental, you need to be able to explain yourself. You need to get resolution. But that may be difficult for him. So I would want to find out why that may have occurred. Now, one of the things that is in the description that I would explore further is difficulty coping with the emotional atmosphere at home. Now, it may have been such as affection and expectations for him made home seem a toxic environment. How do I respond to the emotions of family members, positive and negative? And emotions may be an issue for him, and especially how to respond. So he's really, as we say in England, thrown the baby out with the bathwater in refusing any contact. So in a way, you need a third party to explore why there is estrangement. It may be an extended family member, friend or colleague that can really explore that further. But also, please continue to contact him because there may be family news he needs to know, such as serious illness and so on. So please keep contact. But if he can't disclose, and there will be a reason, it might be that he can disclose it to a third party, and then you can work on that constructively with that third party acting as a facilitator, as there may be misinterpretation of intentions in the family.
And good luck with that. We know that it's heart-wrenching. Also, living with autism, common physical health issues. Are there common physical health problems for people with autism and Asperger's? For instance, are tonsil and or lung infections a common issue?
Yes, there are health problems, but they tend to be of two types. One are stress-related, and the other is the association between autism and autoimmune disorders. Research has shown statistically there's a higher level of celiac disease, inflammatory bowel disease, also conditions like migraines, which can be related to stress. So it tends to be, being autistic is going to be stressful. It's going to be a problem. And your body with cortisol levels and anxiety levels that are high and chronic, the body is going to suffer long term, to be aware of that. You also, with autoimmune disorders, need to look at the genetic components that it may run in families. So I often say to an autistic person, when you see a physician and you have illness, do pass on that there may be a potential risk of autoimmune disorders or stress disorders when they're doing their screening for a number of conditions. Now, from my knowledge, not tonsils or lung infections that I can say. I don't know of that. That may be just coincidental. But another factor in autism is pain perception. And there may be a high threshold of pain perception, which means that medical conditions can become quite severe and chronic before the autistic person is aware of them and discloses them to a physician. So also explain to the physician, I have a high pain threshold, and what for me may be uncomfortable would be excruciating for others. And a physician needs to know, where does it hurt and how much does it hurt? And that ability to perceive and disclose can be different in autism.
Same category, living with autism. This is about psychosis and autism. What is the difference? Dear Dr. Tony, I'm a 35-year-old female and I was diagnosed with autism after finishing university at the age of 22. Unfortunately, at 30, I suffered a psychosis event when my parents divorced. I have found this very distressing, as I can no longer trust my own mind. My time in psychiatric hospital was awful, and my autistic traits were perceived as psychotic ones. Could you please explain or expand on the comorbidity of psychosis and autism, and could you help distinguish between the two conditions?
Oh, yes, please. Thank you. I think that's a very relevant question, and it's one I want to explore in detail, much more detail than some of the previous questions today, because this is something that has universal application. Now, what's clear for me in that description is that the psychosis was considered as a response to stress. It's the old-fashioned term to have a nervous breakdown. And under that stress, in the process of change, there were very intense emotions. And the thing is, when you have very intense emotions, it can lead to delusional thinking. If we have a dimension, there are extremes emotions and logic. And when you have extreme emotions, they're not logical. And so they can appear disturbed, psychotic in a variety of ways. And you have what we call mood congruent delusions. In other words, the intensity of your emotion, your despair, anxiety, and depression really affected your mental state. But whether it was a true psychosis is a debatable matter. And I would also agree that psychiatric hospitals are awful places. I'm sorry. I lived in a psychiatric hospital for 2 years as a clinical student, and I was horrified. This was in the late 1970s. And in many ways, they haven't changed that much. There's been very few, other than, shall we say, medication changes, but that's basically refining the antipsychotics, not an effective treatment for psychosis, etc. Often the treatment is one of sedation rather than treatment in a way that you'd be treated for other medical or mental health issues. And I do as much as I can to keep autistic individuals out of psychiatric institutions because they are not autism-friendly environments, both socially and sensorily, and can be a major problem. So those are a couple of thoughts that she may have had a nervous breakdown, not necessarily a psychosis, and psychiatric units often fail to understand autism. Now, there is a history here that when I did my training in the early 70s, autism was viewed as childhood schizophrenia or childhood psychosis. And so it was born. That's why it is in the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders. It was originally, in the 1950s and 60s, considered a form of psychosis. If you have withdrawal and isolation in schizophrenia for an adult, then what would it be like in a child? We have seen that. So my concern is that historically there has been an association between the two, and subsequently in the late 70s, 80s, recognized that autism is a developmental condition, not necessarily an expression of psychosis. Now, what I want to focus on, first of all, is how the signs of autism can be confused with schizophrenia. First of all, paranoia. It can be a reality that you had such bullying and teasing and people gossip about you, and with your sensitive hearing, you actually hear them. They think you can't hear, they're just whispering, but you hear it very clearly. But also impaired theory of mind, not knowing what people are thinking and feeling and making an assumption it's malicious when it wasn't. So paranoia may be a reflection of reality and not being able to read people's thoughts and feelings. The next one is escape into a fantasy life. Yes, and that's what you need to do sometimes in autism. If you're not accepted and understood in reality, you create fantasy worlds. And in this fantasy world, you are omnipotent. You have lots of friends. You are a superhero, etc. But in autism, there may be a difficulty distinguishing between reality and fantasy, which is so engaging, but you're not aware of how other people are perceiving you when you start talking to your superhero friend aloud when there are people around. And it is really just extreme imagination. The thing is, if you know schizophrenia, and I was trained in the diagnosis of this years ago, there's a qualitative difference that the imagination has a constructive and enjoyable function, not that the devil is causing you to commit various crimes and so on. Now, another one associated with schizophrenia is vocalizing your thoughts. That is talking aloud. Now, I was in psychiatric hospital for 2 years, and I remember in the corridors, schizophrenic patients talking to themselves, and they'd walk down the corridor and they're having florid conversations with no one there. Of course, people do that today, but they're on the phone. And it reminds me, it takes me back of schizophrenia. Oh, no, I didn't really say it. And they're going on and on about it. And then I suddenly realize they've got the earpieces in and they're talking on the phone. But what can occur in autism is a difficulty disengaging mind from mouth and finding that talking clarifies and slows down thinking. And again, as you talk aloud to help your clarification and so on, you may not be aware that this is upsetting other people and they are misinterpreting. Your functional use of that to help you in day-to-day situations are misperceived. Another is delusional thinking, as mentioned in a previous question there, of your intense emotions may lead to a sense of delusional thinking. Also in schizophrenia, delusions of grandeur and power and God mode, narcissistic to a certain extent. It's an overcompensation. I'm superior to others. Also in schizophrenia is thought disorder. When I did my training, it was considered in chess the knight's move across the board. And that's what occurs when you have pragmatic language impairments. You are not changing your speech according to your knowledge of how another person is perceiving what you're saying. So you don't give the links with what you're saying, because otherwise you would suddenly, and now for something completely different, you'll give a bridge with the person you're talking to why you suddenly changed direction. And it seems to be that thought disorder of suddenly changing to something else. It's a natural process, but you've not understood or know the pragmatics of explaining to your conversation partner why this has occurred. Another one is literal interpretation. When a psychiatrist says to you, do you hear voices? If it's a psychiatrist, most people would know they're checking, are you hearing voices of people who aren't there? So an autistic person takes the literal interpretation. Do you hear voices? Well, yes, of course I do. And I see colors and I smell aromas. What a stupid question. Of course I hear voices. I don't smell them. Or, as it can occur, do you hear voices of people who aren't there? Yes, I do. It's people who are next door because their hearing is so acute. They can hear them next door, even if they aren't there. So this is where you get, in many ways, a confusion historically and currently. And my concern is that sometimes there is limited training of adult psychiatrists in autism. I've just come back from the UK. One of the things that concerns me is that in the training of adult psychiatrists, autism is an elective, not compulsory.
Oh, goodness.
And that, I don't know what it is in the United States, but that concerns me, that they're not trained in or confident in differentiating between autism and schizophrenia. Now, sometimes what may occur is the person is having a breakdown and needs to be taken into care. But as far as the hospital administration is concerned, they need a diagnosis that they accept. And so the psychiatrist may say atypical schizophrenia to get them the care they need, without realizing that once you stuck that label on the person, there's major implications in terms of their self-perception, perception of others, medication, and so on. So it's an entry into a hospital but may not be good in the long terms. You've also got, these are some of the research studies that have looked at this, of auditory hallucinations. And there was an instance where an autistic person in a diagnostic assessment for schizophrenia suddenly went, and it looks like you're orientating to voices. But then the psychiatrist said, what are you doing? He said, I'm counting the number of ceiling tiles on the ceiling because it's a prime number.
Yeah.
Okay.
Wow.
Also, another one is camouflaging. And I was doing a diagnostic assessment of a young autistic woman in her 20s with her mother. And her previous diagnosis had been schizophrenia. She'd been admitted to a psychiatric unit. And it was very clear that this woman camouflages. And she observes, analyzes, and imitates. And the mother said, yes, when she went into the hospital, she became schizophrenic because that's what all the other patients had. So to fit in with them, she became schizophrenic. It was the culture. So that's what she did in a way. Now, the presence of schizophrenia in the general population is about 2%, but recent research has suggested that in autism, it's about 6% of autistic people have schizophrenia, so more than you would expect. But when they did a survey of American psychiatric hospitals, they found that 10% were autistic. So there seems to be an overdiagnosis rather than an accurate diagnosis of schizophrenia. You can be autistic and, oh yes, you can have schizophrenia. But it is much less than some of the hospitals and psychiatric services would suggest in a variety of ways. So those are my thoughts on, unfortunately, the excessive perception of autistic traits as signs of psychosis, as they were years ago. So please, I do encourage any psychiatrists tuned in to really check up on this. And any autistic adults for whom they've been diagnosed as schizophrenic, I would ask them to seriously question whether they were genuinely schizophrenic and to review the original diagnosis. One of the things that I'll occur when I'm diagnosing a particular individual is I will hear the parents say, there is schizophrenia in the family through the generations. I'll say, well, hang on a moment. When your aunt or uncle may have developed signs of autism, they may have been misdiagnosed as schizophrenic. That happened on my wife's family.
Oh, goodness.
And her mother, my mother-in-law, her two brothers were diagnosed schizophrenic at 8 and 10 years old. You don't get schizophrenia at 8 and 10 years old unless you have terrible circumstances, and they didn't. And because they were different, they were admitted to a psychiatric institution at 8 and 10 years old until they died in their 60s.
Oh, my.
So when I was, again, in psychiatric institutions in years gone by, there are many individuals that were atypical schizophrenia that I know were autistic. And Lorna Wing, one of the central figures in autism, she trained as a psychiatrist. Her husband was a psychiatrist. And she was very concerned of the over-diagnosis. And in psychiatric institutions, there needs to be a review and education in autism.
Wow, that's quite a story. Thank you. Thank you for bringing all those things to our attention. Next category is depression. Dr. T, I'm a woman in my 30s. I've been struggling with depression. I feel my life lacks purpose. I'm married and I have a job, but my job is solitary, so I don't have opportunities to talk to people. I'm having a hard time making friends. It seems like everybody's busy with their own lives. Even if I manage to find people to talk to, I feel insecure about my social skills. Also, I've got a very narrow range of interests. I want friends, but I can't get around the idea of how to get them. It seems like a lot of work, and I feel very lonely. How do I deal with this?
Yeah, depression can be due to loneliness, and it's people need to recognize that although autism is associated with being introverted and socially withdrawn, you can still feel lonely, and that person is seeking companionship and friendship. And the way it is so elusive is concerning. And the person may be very critical of their own skills and very judgmental of themselves. And the depression can be due to loneliness. There are other factors too. Now, social connection, especially for adults, usually is due to work or out-of-home activities. So when it comes to work, I'm going to do a quick plug for Michelle and I, Michelle Garnett, have a book called Autism Working, a seven-stage plan to thriving at work. Published by Jessica Kingsley Publishers, jkp.com. In this, we have a chapter on how social challenges may affect somebody in a work environment and how to explain your social difficulties to colleagues and line manager. It's not to change who you are, but to explain it. So we go through examples. What are the aspects of autism that other people may find confusing, abrasive, or they need some guidance? And how can you construct, perhaps with your partner, an explanation of the challenges that you face, that other people then may have more compassion for your isolation. Mm-hmm. So I would recommend that, but also to talk to your line manager that you would like more engagement with your colleagues. Now, that may not be going out drinking with them. I would not recommend that. But it may be to look at the organization, if they could have any team building activities that enables individuals to get to know each other at a social rather than a professional level. So check, does your company or government organization have team building exercises that will help you? Now, there are also books on friendship for adults. There's Don Gabor's How to Start a Conversation and Make Friends. This one is actually for autism, 60 social situations and discussion starters. And this one also, How to Start, Carry On and End Conversations. Now, these two are specifically for autism. And it may be worthwhile having a read of those to really boost your skills and confidence socially. Another way is seeking perhaps further qualifications and attending courses to make friends. It's a good way of restarting your social network, or volunteer work or through a church or something like that to meet people out of the work environment. But I would also suggest guidance from a psychologist specializing in autism to assess your social skills. What do you do that's okay? And also providing guidance. What the psychologist can do is take imaginary social situations and role play them. And then sometimes videotape them with you so you can see your own presentation, how you appear to other people, and then give you guidance of what to do, re-videotape it, see the differences. So you need a mentor or guide in social situations. It's almost like drama therapy. It's how to act and what to do. And the other final point is your partner able to provide guidance and support?
Mm-hmm. Learning about self. The next category is relative to anxiety. It's about catastrophizing. Help. I'm a 32-year-old adult who was diagnosed when I was 21. Every time something negative happens, I have the tendency to think the worst. Why is catastrophizing so easy to do, and how do I avoid it? Is there a way to help me calm down, look at the situation clearly instead of blowing it way out of proportion? Are there steps that I can take to ensure this doesn't keep happening?
That catastrophizing can be a major issue in daily life. And it seems that something that is relatively trivial seems to trigger a major emotional negative reaction. And that can be of great concern to the person, but also other people who are sometimes taken aback, maybe even scared of that person's overreaction to the situation. Now, what I would suggest is looking at what we call cognitive behavior therapy, CBT. And the authors in CBT divide thinking into adaptive thinking and maladaptive thinking. Catastrophizing is maladaptive and actually very common in autism. Now, in our book, again, I can plug another book, Exploring Depression and Beating the Blues. We actually have a chapter on thinking, maladaptive thinking, that includes catastrophizing and some ideas of what to do. Now, it's an extreme emotional reaction that is basically magnifying the problem. So we say, take out the mirror, not the magnifying glass. You're to reverse the telescope in a way. So it is looking at the situation realistically before your emotional reaction. So it may be to take a pause when you notice you're getting agitated, and that can be difficult for you to perceive, but there may be an occasion when you realize and ask other people, when I catastrophize, what are the signs? What do you notice? Because I'm not aware of them. Well, you tend to pace, you tend to perseverate on this topic, you start to become louder in your voice, you become bombastic, and you use these sorts of gestures. Right, okay, I need, should we say, the cues that indicate I'm catastrophizing, so I can observe them, absorb them, and learn from that. Mm-hmm. And then when you notice that's occurring, say, take a pause, take a deep breath. When I'm calm, I'm smart. I need to be smart. I need to be calm. I'll take a deep breath. It's the old classic count to 10, or I will breathe in for a certain amount of time, but a longer time breathing out. I need to get back into self-control because control is disappearing. Now, for example, a thinking distortion is making a mistake and catastrophizing. I'm a failure, I will never do this, and so on. Well, realistic thinking, and that's part of cognitive behavior therapy, is changing your reaction from I'm a failure to I made a mistake. But I can learn from my mistakes. Next time, I'll be wiser. Mm-hmm. So you have an inner voice that is the voice of a best friend, or maybe a mother years ago, or a partner. So you need an inner voice that is calming and reassuring in a way. Mm-hmm. But definitely guidance from a clinical psychologist to help you challenge your distortions in thinking. So it is a longer answer, but it may be that it is something that could be alleviated. But I think you do need a clinical psychologist. Get a list of those situations that make a catastrophe. Make a plan. What can you do in each of these situations, and then give feedback. Mm-hmm. Now, what they may do is take a list of situations in a hierarchy. What are the worst? What are the least? Right, let's get a plan for the least. Mm-hmm. Between now and next week, this is going to happen. Take a deep breath and so on. Let's see if we can get some success here. Mm-hmm. And then gradually build up the hierarchy mm-hmm. once success has occurred.
Mm-hmm. The next is really two categories. It's masking and making and keeping friends. Hello, Dr. Tony. I'm a 17-year-old male. I have different characteristics for different social groups. For older people, it's the perfect grandson, lovable personality with old school manners. For people my age, it may be moody, sarcastic, and not caring, or making jokes, mostly morbid and dark humor, all the time and laughing like a mad person. With my family, I just mostly try to hide some of my behaviors because I feel vulnerable and angry. Also, I don't want to talk with anybody when I get home from school. I don't really have any friends with whom I can be real. I think people may be scared of me or just not interested. What personality would you suggest I try to attract more potential friends? Thank you for your help.
Okay, first of all, what you're doing is actually very wise, very appropriate. As in the phrase, when in Rome, do as Romans do. And what you've done is you've become a chameleon. You have become the person needed for the situation. That's actually quite a constructive adaptation, when in moderation. And the thing is, you may not know who is the real you because you have learned to act in various situations to become the person appreciated by others. That's great, but it means that you're not able to discover and accept the real self. Now, if you're looking for friendships, one of the things I would recommend, sometimes the best friends are autistic friends because they're more likely to accept you and understand some of the eccentricities that you may have, because they'll have their own eccentricities and they may be far less judgmental and dismissive. So could you link at school, as you're 17 years old, there may be other autistic students at that high school, or a local or internet support group. That's another group that's missing in your life. And that may be the opportunity to be the real self and find true friends. Now, you mentioned, are they scared of me or just not interested? I strongly suspect they're a bit confused. You're blending in, but may not be perceived as cool. Now, the thing is, you're 17 years old, and other teenagers are not the easiest person in the world to get on with. They're not. They are intolerant. They are they are horrible. When we look at what is the most dangerous creature on this planet, it does not live in Australia. It's all over the world. The most dangerous creature on this planet is a group of teenagers. They will do things that no animal will do to its own species. And you are trying to relate to them. Now, please, one day they will grow up and they will appreciate your honesty, your loyalty, or your qualities. So can I ask you to be a bit patient? When they grow up, they may be able to connect with you in a more constructive way and recognize your true quality. So be patient and see if you can connect to some other autistic individuals to be your true self. And if you are going to have true friends, please explore the true self.
I also might consider going into acting. There's a number of very famous autistic actors. Clearly.
Oh, Sir Anthony Hopkins.
Yeah, that's right.
And what you've done is you've observed the mannerisms, the actions, the voice, the accents of other people. And you do that. In fact, you may consider drama as a high school subject or something you could take later on, because you've been an actor for much of your life. You have been rehearsing various roles and scripts. It may be a talent, and you won't be the only autistic actor. It's a major career choice for many autistic adults.
Even the way he wrote that question, I mean, he was just so into, it's the perfect grandson, lovable personality with old school manners. This person should be a writer or an actor. All right, next category, empathetic attunement, ASD and animal love. I wondered if empathetic attunement toward animals has been documented in the autistic field. I feel physically stressed when an animal is in distress or injured, as well as an intense and prolonged emotional response to any reports of animal cruelty. Since I was little, I have always had an intense desire to protect all animals, including insects. My realization of autism has come recently after the loss of my dog. And learning about autism in women has been a great relief. I'm a 32-year-old female. Many thanks, Jessica.
Very interesting question. Not documented in terms of research, but recognized clinically and definitely in autobiographies. And my clinical experience is that there seems to be a phenomenal bond between an autistic person and an animal. They have a sixth sense for each other. I think the animal recognizes that an autistic person is genuine, is not going to cause any harm, and they can relax, especially animals that can be prey, like horses, chickens, and so on. And they recognize in that autistic person a style of movement, and I think also a mental connection. That this is when you have horse therapy, canine therapy, and all those sorts of things. There's a bond between an animal and an autistic person that's really quite extraordinary. Now, the thing is, the animal is the best friend. They are non-judgmental. They are very accepting. They are so pleased to see you. They're the best friend you could ever wish for. And then you think, how could someone be cruel to an animal? And that really defies all your logic. But then there is a very powerful empathy for animals, as though someone is hurting your friend or your children in a way. So this may lead to a career actually as a vet or vet nurse or in a zoo, for example, or a wildlife ranger in the ability that you just sit down and all the animals congregate around you because they're curious and safe. Temple Grandin is the classic example. And, I've seen films where Temple, with a group of cows, she will approach them in a particular way, being aware of movement and eye contact and so on. She knows how to be non-threatening. She'll sit down, and within moments, the cows are curious but safe. And they approach her and just check her out and so on. And that approach and acceptance is so valuable for an autistic person because they may not get that with humans. Mm-hmm. So what I'm looking at is animals are not as complex and malevolent as humans, and they are true friends. So after the loss of your dog, yes, there will be very intense grief, sometimes greater grief than for a person, because there's been such a deep bond and connection with the animal. The loss of that is devastating. Mm-hmm. So it may well be that a new dog needs to come into your life. And what you may do is, it sounds a bit, well, it may be a valuable a process, that when your dog is dying and should we say, is of an age that there are not many months or years to go, have another animal that they can learn from each other. And the new dog can learn the strategies from the old dog for continuity. Mm-hmm. So that may be something to consider.
They also keep themselves company. We have been staggering our pets. We usually have one that's 1 or 2 and another one that's 5 or 6. Because they learn from each other, they keep each other company, and they're just a joy to have around. I'm glad somebody asked that question because most of my friends with autism are excellent with animals. Okay, last category, intimacy, dating, sex, and marriage. Neither of us like the idea of a wedding. Is it normal for people with ASD to hate the idea of having a wedding? My partner and I, both on the spectrum, have been together for 10 years and engaged for 5. We're both completely committed to each other and like the idea of being married, but neither of us really like the idea of having a wedding. And to me, the thought of spending money on a one-use dress and everything else seems crazy. I would much rather save for our future. Weddings have so much expectation and stress and socializing and general tension and confusion. I don't even like attending them, let alone being the center of one. Luckily, we both feel the same way, so there's no tension between us on this point. However, I know that a wedding of some sort is important to our families, and they want to celebrate with us, which I do respect. Do you have any thoughts on an Aspie-friendly wedding and how to keep family happy in the process? Kristen.
Oh, what a lovely question. Hang on, whose day is it? Actually, it's your day and needs to be what represents you. Now, one of the things that's there is, yes, the practical. How much is this going to cost? We have other important things. That's a very logical way of dealing with it. There may not be the romantic view of weddings. But the problem with weddings is they're so emotional and people are so easily offended and overly emotional. And how do you respond to your mother's crying and other people coming up and hugging you? And they become very strange neurotypicals at a wedding. And they do all sorts of emotionally powerful reactions that an autistic person has great difficulty resonating with. And they endure the wedding, not enjoying it. So, really, my personal opinion here is do what you want to do. And if you want to get married, just the two of you, that's great. Now, you've been together for 10 years, engaged for 5. So it's not a relationship that's only been a few months. This has been a long-term relationship. And they need to understand that. Mm-hmm. I mean, it's a shame that you can't have weddings on the internet. So they're all there, but you have to engage. And then you can just press off and say, oh, the internet was down. So you can't connect with them. So what you can do is have a small one with very close family, but then you offend the others and they're all offended and they for years also, but you never invited me to your wedding and accuse you of that. So you either offend everybody equally and they can support each other in their offense, or you have to endure something for the sake of others. If you are prepared to do that, fine. But if you want to go ahead, and elope, the two of you, and just get married and then tell them. That's what my wife and I did. We got married because there was going to be all this fuss and so on. And we told everybody in the family the night we got married. Oh. So we got married in the morning, and then we had a long time on the phone. I remember the people, there was just silence when we said, we're married. What? Anyway.
Good luck to you guys. Thank you for you're so thoughtful, Kristen. Thank you for this note. Last question, also same category. Asperger's and PTSD. What would be the best resource for dealing with a marriage in which the man has Asperger's and the woman has PTSD? Both see the other as being angry much of the time. The PTSD victim is also suffering manic depressive disorder. The Asperger's man can't respond quickly enough when the PTSD victim fires an accusation at him. And since no instant answer is given, the accusation is confirmed in the mind of the PTSD victim. Also, the similarity of symptoms in both leads to a bit of finger pointing.
Wow. Oh, dear. I am concerned about this because something needs to be done to rectify the situation. I think they would benefit from counseling and treatment for the PTSD and manic depressive disorder. Both are treatable. When it comes to PTSD, EMDR can be successful, and there is medication, to a certain extent psychotherapy, for manic depressive to moderate, because you're going to get these ups and downs. It will sort of flatten them. They'll still be there in the background, but not so abrasive in a relationship. Now, with the autistic partner's processing delay, yes, because the autistic person has got to think what to say or what to do to minimize distress and not inflame the situation, and is often misinterpreted. An autistic person has to use cognition to process social information. And when we do cognitive assessments, there's a problem with processing time. And so when there's an expectation of a fast, immediate response, the person finds that very difficult, and they don't want to make a mistake or make it worse. So they're ponderous, but then accused of not being appropriate in their response. So that needs to be explained. What they need is relationship counseling with a counselor who knows autism, who can explain the autistic characteristics and legitimize them and consider coping strategies to the non-autistic partner there, and how they are being misinterpreted. They need legitimizing. There also seems to be a lack of compassion and appropriate adjustments within the relationship. So they need psychiatric, especially for the manic depressive, psychological support for, I would say, the PTSD, and relationship counseling with a counselor familiar in supporting couples. Now, what both partners may do for the autism side is read some of the books on partnerships published by Jessica Kingsley Publishers. There's at least a dozen of them. Maxine Aston is one of the leading authors in this area. So I do suggest that they read those books together or same book separately and highlight those bits that are relevant to them. Excellent. To legitimize and explain, because most of them go through categories of autistic expressions in a relationship and what to do to help. So if you can't find a relationship counselor, do have a look at the literature. Very good.
Dr. Tony, that's all the questions we have for today. And as usual, thank you for your explanations. I do have a question, though. Do you have any pets?
Yes, we have a dog, Lucy, a Staffordshire Terrier.
Okay.
Who has been magnificent for my wife, who adores her and has been incredibly helpful.
I just was curious because you strike me as more of a cat person for some reason, but I can't explain why that is.
Yeah, you're right. You're right. If I was going to have a pet, it would tend to be a cat rather than a dog. But we've had rats and all sorts of things. But at the moment, we have Lucy, who's 2 years old and loves going for walks and giving attention and all sorts of things. Okay. So yes, we have a dog.
Yeah, I didn't mean to put you on the spot. I was just curious. All these years I've known you, I've never asked a question like that, and I never see anything running around in the background. So I guess that's why I had to
and
ask.
sometimes you may hear the pat, pat, pat upstairs of Lucy running around, or she could be in the garden, and you may see behind me in that area.
I do know it's 10 o'clock in the morning where you are right now, and you have to get about your day's duties. So thank you for giving us the past hour and your experience. And thank you, Autism Hangout, for tuning in. And see you again soon, maybe in another month or two.
Yeah, and keep sending in some really good questions. I enjoy reading them and answering them. It's an absolute delight.
Yeah. Thank you again. Thank you, everybody. Good night.